Felix Salomon is a Phoenix native currently, a psychologist, a psychoanalyst, and his name precedes him. That's one thing that I've always heard about him before I actually met him. He lives in my neighborhood. I've always heard about him and his wife shared, until they began to volunteer with us, which was my pleasure of meeting him and his wife. They're very active in the community. They're very active with their Temple Chai, and we're very honored to have him today to share what I call some wisdom, some grounding ideas for all of us during this crazy time where there's so much unknown, which gives us a non-steady footing, which we always crave for. So that is my introduction to Dr. Salomon, and I would love for you to just share a little bit more about yourself, your practice, and anything else you might feel that we should know.
Okay, thank you very much, Rabbi Levertov. It's my pleasure, my wife's pleasure, to try to help and serve the Jewish community. We volunteer at Smiles on Seniors when we're able to, especially in the non-COVID world before. I would just, I'm not sure what's pertinent and what's not pertinent. I'll just tell you a little bit about myself, and that is that I was born in Montevideo, Uruguay, because my parents were running away from Hitler and they weren't able to get into the US. At that time, there was a quota system. Only a certain number of Jews were allowed in. So we went to South America. I was born there. When I was 4 years old, we were able to get into the US through my mother's brothers, my uncles. And I grew up in Elizabeth, New Jersey, and then Queens, New York, and then moved here with my wife and my two daughters in 1977. I've always felt like a fish out of water here in the desert. I'm never really that comfortable being here. I'm sorry. But I have to say, Phoenix has been very, very good to me and my family. And yeah, so I really like questions, and I hope this will be a very informal question and answer discussion period rather than any kind of formal presentation. I do have some concepts that I can present to you, but I would love you to at any point ask me questions, and we can go off on tangents. I'm very used to free association as a very therapeutic dynamic, which means, you know, loose associations, really. So any thoughts, any questions that you have about what I'm going to try to present to you, please feel free to ask. And interruption is the wrong word. It's just, yeah, let's say interjection. Okay. What else, Rabbi?
First of all, I like that. I'm going to steal that line. Interjection instead of interruption.
Yes, yes. I'm not finished talking, but you might have something that might help me to talk better. So go ahead.
Well, no, first of all, I thought it would be best if you, like you said, that you present exactly how you shared it. You
Yes.
just, and then I know people will ask questions.
Okay. So should I just start then?
Yeah, you're perfect. You're on time.
Does anyone want to ask something first right away?
How about we say you, they might want to, but let's say you go ahead anyways, and then.
All right, it's not a good sign. All right, let's try.
Oh, well, someone asked, but it's not about what you're going to present on.
Oh, that's good then. That's good. Let's see.
Why did you move here?
Why did I move here? I had a temporary psychotic break. I thought Phoenix really wanted me because San Diego was going to charge me $1.50 for the brochure, and Phoenix sent me all kinds of material for free. And I thought, wow, they must really want me here. And I found out they really didn't know what to make of me, because I am very psychoanalytic, and that is quite alien to most residents, let's say, of Arizona. And I really honestly couldn't stand the very cold winters anymore of New York. So I was looking for a warm place. It was between San Diego and Phoenix won.
And then maybe before you present, one other question, I think, because I have the question, most people probably know the answer, but can you share the sort of the practice when you say psychoanalysis, how that differs from other psychologists in the approach?
Yes, very good question. But first, is it Carol or Gerald Webner who says we can't see your whole face?
Yeah, but now you're good. You've moved back. So now
Oh,
you're
I
good.
moved back. Okay. So, and Sherry hails from San Diego. Wow, wonderful. Let's see. What distinguishes psychoanalysis from the other types of psychological theories or theories of therapy is that it values emotions very highly. It believes that emotions are our most important aspect in terms of helping us to survive and self-preservation, and also in terms of information about the outside world. Secondarily, we believe that cognitions are very important, what we think, what our thoughts are. And then third comes behavior. So it's quite different for, let's say, cognitive behavioral theory, which believes that our thoughts are most important and that the thoughts can control the feelings, and then we can control our behavior better. Psychoanalysts believe the other way around, that if you understand your emotions, you can help your thoughts more, and then you can engage in more rational behavior. So that's the main difference from the most different type, which is CBT, cognitive behavioral. Okay. What else?
Thank you. That was clear.
Also, the importance of childhood and the importance of, early events that shape and influence our personality as we develop.
So now moving into sort of what everyone is experiencing, I'm going to say for the last few months. And of course, we haven't heard your thoughts yet, but how would the two sciences sort of differ in the approach?
Well, a psychoanalytic approach would first of all try to help you identify what your triggers are, what triggers your uncomfortable feelings, let's say, about what's going on. The triggers are based on a concept called transference. Transference is our reaction to any situation that actually reacts to what the situation reminds us of from our earlier years. And it is usually mostly unconscious. So we don't even realize that that is what is determining our reaction. For example, let's take two aspects of this COVID situation. One, it has to do with the possibility that if we get this virus, it can kill us. Or what I believe is even worse, we can get the virus and then we can transmit it to someone we really love deeply, and it kills them. And then we have to live with the terrible feeling that we have infected our loved one and that they died from it. Okay. So there is the fear of infection and contagion that if we're responding in an overdetermined way to that, like a really high level of response that is beyond reasonable, let's say, precautions, we would need to dig for what happened in our early childhood where we dealt with an unresolved situation where maybe we got hurt or someone we loved got hurt because of a contagious illness of some kind, or maybe just illness of some kind. So overdetermined means reacting to what the reality is now, but also an additional level of heightened emotion about it because we're adding on to it what we experienced before from early experience of childhood. Okay, so that's one aspect. Another aspect has to do with taking our autonomy away from us to some degree, our ability to control our own lives, our ability to be in charge of our own lives. So, for example, we have a mandate to wear masks, right, from the mayor, I think, of Phoenix, and to socially distance. Even though that might be in our best interest, we might be reacting to the aspect of losing some degree of control. Why is that such a terrible thing for us to be able to just adjust and adapt to recognizing that, okay, now we have an added degree of loss of control because we were never really totally in control of our lives anyway, right? We can't be omniscient and omnipotent. So this is an added factor for our safety. And if we are overreacting to that, an overdetermined reaction, then we have to look, a psychoanalytic therapist would try to help you to understand what happened to you as a child where maybe you didn't have enough self-regulation, self-control, or ability to determine the direction that you wanted to go in with your life. So I see a question here. Why are so many young people here from Sheldon? Why are so many young people here in Arizona not following recommended safety standards? This boggles my mind. I really can only speculate on that. I really have thought about this a lot, but it's not just Arizona, it's other places also. Like we see young people in Florida just going crazy with parties on the beach. And there's even now, I'm sure some of you might have heard of this, COVID parties where young people, I think this is college age, who have been tested positive for COVID, get together for a party with other young people who aren't positive, and the first non-positive person who gets it from the people who had it win a prize of some sort, a monetary prize. If that isn't craziness, I don't know what craziness is, but this has to do with developmental psychology, really, that helps us to understand that until we get to be a certain age and hopefully have some healthy developmental process in terms of understanding death, young people tend to feel immortal and invincible. And for those who don't, we really have to confront the possibility that they really do not care that much about being alive. Another way of putting it is that they might actually have a death wish. You know, Freud believed that there were two main instincts in life, although I really believe there are three, but he believed there were two. I'll tell you the third in a second. The life instinct and the death instinct. And until we die, the life instinct is the stronger one. And of course, that's what the Torah teaches us, is to choose life and to not do anything that hastens your death. So I don't want to, you know, talk too much from the Jewish point of view, because I feel that's rabbi's role to do that. But I want to share with you that that's my, you know, I went to yeshiva in Elizabeth, New Jersey, and I have a lot of Judaism in my blood, so to speak. So, and of course, I'm still trying to study and do things Jewishly. So I combine that a lot with my practice and my theories about life and death. I think that, so the third instinct, I think, is the social instinct. And this is why this situation is hurting us so much. We were not meant to live alone or in isolation. We were meant to be with other people. And this is making it very, very difficult to be with other people. So the short answer is the young kids either really don't think they're going to die from it. Maybe they'll get a little cold. They don't realize this is different from a cold or a regular flu, of what we've known as regular flu. Or they really are, in a sense, willing to take a risk, and that is, there's no other way to say it but to say that they have some suicidal tendencies.
So with that knowledge that you really address the feeling, sort of, if you're anxious, let's talk about why you're anxious, if I understand it correctly.
Yes.
What would be, and I understand that obviously that means that you can never answer a question while someone stands on one foot, to a degree, because there's so much more that you have to unpack.
Right.
But what would be your advice? What would be your advice to all of us on today regarding, I know that I love the word you used when we talked on the phone, and I'm not going to pronounce it correctly. Angst, which is the German for anxiety, correct? Or
German Yiddish, I don't know. I think they share that word.
So what would be your, because I actually titled, okay, anxiety, fear, stress, those are three different things that you'd have to address.
That's right. So anxiety, I'll just talk about that a little bit, and then please ask again the question.
Sure.
Anxiety is different from fear, right? Anxiety is a vague apprehension about something terrible or not good that is about to happen. It's an unidentified threat. We don't know what it is, but we do know it ain't gonna be good. So we get this terrible feeling inside of us of, you know, angst. Okay. Fear, on the other hand, did I do that all right? Fear, on the other hand, is a response to an identified threat. If someone holds a gun to your head and says, give me all your money or I'm going to kill you, you know what the threat is and you have fear. And unless you're Jack Benny, you give him the money. You know what Jack Benny said in that situation?
Remind me.
Let me think about it. Because he was supposed to be so. Okay. So anyway, so that's, fear is identified threat. Anxiety is a vague uncertainty, a situation where you don't really know how it's all going to work out, or you don't really know what it is that's going to hurt you. Okay.
So are we experiencing then more anxiety, or would most people be feeling more anxiety today rather than fear because you
The
didn't get?
favorite psychologist answer to all question is it depends. So what does it depend on here? It depends on whether the person is more reacting to the possibility of the real threat of getting deathly ill or really dying. That would be fear. If the person is just a mess of not knowing what the hell is going on and doesn't know what they should do and how they should do it, that's anxiety. When you have fear, you pretty much know what to do to keep yourself safe. When you have anxiety, you don't know what to do because you don't know what it is you're trying to defend against. Best thing to do is to get into therapy, of course. But, barring that, you really are sort of at a loss. And you might have spielkas.
Great word.
Yeah.
So on that note then, to all of us, and this is where I come back to that question, what would be your greatest, I guess, words of advice or wisdom, of course, barring sitting down and properly assessing and analyzing, to every single one of us during this time?
Keep yourself safe. Be healthy. Do acts of kindness. Do mitzvot if you can for others who are in a kind of handicapped situation where maybe they can't get food to their house, or they don't know how to do that. So help them, help others if you can, and study Torah, for heaven's sakes.
Wow. Are you sure you're not a rabbi?
I had a big fight with the main rabbi of my yeshiva. When I was in about third or fourth grade, he called me into his office. It's going to make me cry. Sorry. He said, Felix, you should be a rabbi. I said, I don't want to be a rabbi. I want to be a psychologist. So he said, okay, get out. So I went back to the classroom and I studied.
That's an amazing story. So you already knew.
That is a true story.
I believe it.
That is a true story.
That's an amazing story. So you already knew at 3 you wanted to help others through
third grade. Third grade,
sorry, through medicine.
Yeah.
Wow. Did you already know it would be through psychoanalysis?
No. I didn't know that until I got into college, my first year in college. And I went to Queens College, City University in New York, and I had a wonderful introductory to psychology teacher who was a psychoanalyst. What he was doing there, I don't know, but he kind of made Freud an important part of the introduction to psychology. And I thought, wow, this thing about the unconscious, that makes a lot of sense to me. It just made a lot of sense to me. I thought, then I could really try to help people through that study. Yeah.
So here's a question, I think, a question that came in the chat. Is there a difference between anxiety and a panic attack?
Yes, big difference. Thank you. Thank you for asking that question. Big difference. Okay. So anxiety, I spoke about a little bit now. I'll just talk a little bit about panic. You'll see how different it is. Okay. A lot of people make the mistake of thinking that panic is just a very, very high level of anxiety. No, it's really of a different quality. It's a different animal. And that is that in panic, and this is really much more my own personal study of panic over the last like 43 years that I've been doing this. Panic is that special kind of position where you are about halfway from where you are coming from and halfway to where you are going to. And all of a sudden, you realize that you don't want to go to where you're going to, and you don't want to go back to where you came from, and you don't know what to do. And you feel ambivalent, which is the very terrible feeling of having equal opposite feelings about the same thing. So what does it do? It paralyzes you. It puts you in an immobilized kind of state of, I have to just freeze and stay here because I can't go back. I can't go forward. Oh my God, what am I going to do? That's panic. Anxiety is a lot more, like I was saying, spilky. So you're all over the place. But panic, you're like frozen. Okay.
Thank you. Yes.
Yeah.
And again, I'm just encouraging others. You can use the chat. If you feel it's a more of a personal question, you can actually send that question directly to Dr. Salomon. If you're not worried about people knowing who's asking the question, you can use the regular chat.
Yeah.
Do you mind if I bring you back to a point you made?
Of course. Go ahead.
You mentioned that the greatest sort of function, I don't know if you said the greatest, but the function to sort of help you deal with the times that we are in, the struggle, the anxiety, or the fear, whichever a person is experiencing, is really through doing kindness to someone else.
Mitzvot, acts
Yes.
of kindness. Yeah.
Is that something that all doctors of psychology or psychoanalysis would share, or is that your Jewish take on that? Because there's a very Jewish thing about that.
I know.
Finding happiness through helping others.
I hope most psychoanalysts would agree with me, but I don't think they would.
I don't mean if they would agree or not. I'm saying, would they find that that's a solution as well?
As part of a multi-factored solution, yes. It's by itself, it's not enough, but it's a tremendous help to the person as they're gaining, let's say, insight into what's causing their anxiety or fear. Oh, and you know what? I didn't talk about stress yet.
Okay.
That was in the title, right?
Yeah.
Okay.
I figured
Huh?
I think on the phone we said those are truly three different
Yes.
feelings.
Yes. So stress is the other side of the coin from tension. I'll explain. Stress is a demand that the outside world makes on us. So when we have this demand coming from the outside world, we need to respond to it. A demand is something that needs to be responded to. Even if we decide to ignore it, the decision to ignore it, which usually is not a good decision, but sometimes can be good, but usually not, it is a response. Okay, so the light suddenly turns red. I have to step on my brake, right? I have to get ready to stop. That's a stress. A stress can be good, in which case it's called the eustress, EU stress, from euphemism, from the Latin root eu, to mean good. I don't know if that's Latin or not, but I keep thinking of the joke, everything reverts to Latin, like jalapeno, the Latin root jalapeno. That's it's a loose association. Anyway, so there's good stress, like getting married, buying a house, when you're ready to move into a house with your family. This is stressful. You have to do a lot of, there are many demands that will make on you. And of course, there's negative stress, like this terrible virus that scientists are saying eventually, before it's all over, they're approximating that about 70% of the world population is going to be infected by this virus. Okay. Tension is the demand that comes from our inner world. our own psyche. The psychoanalytic term for that is intra-psychic. Within the mind of the person, there is a conflict. One part of the person is fighting against another part of the person, and that creates tension, and it demands a resolution. Hopefully some kind of compromise can be reached, and the key to a very good compromise is where the pain is equally distributed among all the participants. Nobody really cares how happy someone is, but they care more if someone is in a lot more pain, especially the self. If I'm in a lot more pain than the other person that I'm dealing with, I'm going to feel this is not a fair situation and I have to balance this out somehow. So anyway, this COVID virus is a horrible stress on all of us, because it demands that we go against one of our most basic needs, to feel free to socialize and be with other people, to not have to worry about getting close to someone physically. So it's a terrible stress. Let's see, this is a big one here. The first few months of COVID, I actually enjoyed. The fourth month got a little tedious, but now that's how I'm feeling about Phoenix right now. But now beginning the fifth month and seeing the numbers and death continue, yeah, changing the dynamics. The thought of not getting a ventilator is causing some stress, along with hearing that there is a stronger virus now being passed along. There is two other viruses now that are being reported, but they're not sure that it can be transmitted to humans. One is with pigs, mainly pigs and cows, and the other is a rabbit, wild rabbit virus. But they're not, right now, I didn't hear that it's actually transmittable to humans. This thought has made me go from happy and positive to okay, but concerned. I would say that's a healthy place to be. Concerned, so meaning hopefully cautious, careful, keep yourself safe, keep the ones you love safe, and speak up. Please speak up and have a voice if you see someone doing something where they're being inconsiderate of others, like not wearing a mask, or taking too much chance for themselves. We have an obligation to each other to help each other. And if we see someone doing something dangerous, we have, I believe, an obligation to say something.
So I'm going to there's a bunch of questions before that. If you don't mind, I'll read them to you.
Oh, okay. I didn't see them. I'm sorry.
Yeah. So no, you were in the middle of talking and then more came up. So I'll read a couple to you.
Yeah.
Someone asked when you were talking about the panic attacks, if you can give an example of a panic attack. I'm not sure if they meant in how does a person sort of react when they're having a panic attack, or it's not necessarily as clear.
Okay. I use a lot of humor in my work, and my wife's main complaint about me is that I use too much humor and that I don't take things seriously enough. So please forgive me, but the example that, and I'll tell you a little personal reason why, but here's the example I thought of. Let's say that you are leaving an unhappy home on your way to a job that you really don't like. And halfway to your job, you stop your car because you've had enough. You've reached your limit. You're not going to go to that job, but you don't want to go back home either. So you're going to stay in that intersection. Hopefully you'll pull over, but you might not even be able to pull over depending on how serious it is. So there you go.
Yeah. Okay. And if she meant in the sense of how a person internally, Lori, if you don't mind, you can chat back on that one. The next question that someone asked was, if you're in therapy how to deal with the anxiety and lack of ability to be social. I'm reading it as is.
Okay. If you're in therapy, okay, so hopefully you are with either a psychoanalytic therapist or a psychodynamic therapist, which is very similar but not quite as intensive. Little family action going in the back there, Rabbi.
Yep.
That's okay. That's a sign of life. That's a good sign. So, so you would try to do a little bit of what's called transference analysis, which is using the person of the therapist to work out and work through some of your anxiety about being social, because he or she is a person also, and you are being social by being in therapy. You're relating to another human being, and you're discussing very personal things, and you're forming opinions about who this person is, how close you want to get to them, and whether they're smart enough to help you. So you want to be able to discuss that and try to identify what the threat might be of, number one, getting too close, which could be, all of a sudden, well, maybe the therapist will die, and then what am I going to do? Or number two, being too far away, which is, more like, I don't care, apathy, nobody really cares, and just getting into a really unhealthy attitude of not caring, basically. So that's a beginning of maybe an answer. There's so much more. That question can take us into about 5 years of analysis right here.
Wow. So you mentioned a point. This is again me, the ignorant one over here in years for sure.
Not ignorant, learning.
Thank you. I'm getting all these new new ways of rephrasing paradigms.
Yes.
So a typical, you just mentioned the amount of time it could take to sort of come up with the problem and the solution. I assume that's what you mean.
Right.
A typical, there's no such thing as typical, as you mentioned, but a standard issue you're saying is never a quick solution.
Hardly ever. If it's a quick solution, you have to hit yourself on the side of your head and go, duh, why didn't I think of that? But if you have half a brain, there probably is not an easy solution, right?
Right. That's a good point. There is, just for everyone on here, there's for me, it's a beautiful teaching that I always like. There is a verse in Psalms that says, I might have shared this here once before, that a worry, da'aga belev ish, a worry in the heart of a person. It's from Tehillim, from Psalms. So the verse says, Yashchena. The question is, what is that translation? And there is a commentary that says it should be read Yisichana, which would, one interpretation means you should just push it out of your mind. The other interpretation says you should speak with somebody about it. Which is, of course, something we should.
Guess which one I favor.
Of course, the talking. I think it's clearly talking to someone is a very Jewish, I'm going to say, value. Don't take this on by yourself. Talk to someone, whether it's a professional or a friend, but the idea is let it off your chest. Share it with someone. That's already half the solution.
Yes.
Going back to questions, though, since
yes.
I want to make sure everyone who has a question can have their answer. You had mentioned earlier, and this one actually came from Facebook. You had mentioned earlier that the COVID parties that people are doing is either because they don't value life to a degree.
Yes.
Or that they didn't have good parenting to a degree. It comes from their home, their values. I don't know. I'm rephrasing.
Yeah, that I didn't say that, but okay.
Well,
I said it either comes from the death wish that really they don't care about living, or they really are still in that very young mind of feeling invincible and immortal.
So here is a question that someone's mentioned, is because for us, COVID is new. But when you talk about there's really nothing new under the sun, to use that phrase. There have been chickenpox parties. So, she wrote that possibly chickenpox parties could stem from that same idea. They've heard of this concept. It's not like they came up with it. So just, I guess I don't know if
Think about Russian roulette. That's the same concept.
True.
Have a Russian roulette party.
Yeah, I'm not in.
I'm not in either.
So here is another question that was written privately, just so I guess they don't want their own name on this. But can you address guilt and being sort of in the middle, being the sandwich generation? This woman has an older mother who's unable to go out during these times. One of their sons, the dad of 2 young children, who's been maskless. So the stress of dealing with both generations
Yes.
and their thoughts, and then still taking care of themselves.
Yes. I don't know if this, for some reason, this joke makes sense to me, but I don't think it makes much sense to many other people. The Jews invented guilt and the Catholics perfected it. Does that make sense? But anyway, the sandwich generation. Okay, so guilt comes from feeling that you've done something wrong. It's different from shame, which is the feeling that you are inadequate, that you're not strong enough, good enough to deal with what you need to do. Let's stick with guilt. I've done something wrong. So there are 2 basic kinds of guilt also. There's neurotic guilt and there's realistic guilt. Realistic guilt is when we feel guilty because and I'll leave out the New York word there, we have done something wrong. And we should feel guilty. The neurotic guilt is where we actually haven't done anything wrong, but we still feel guilty as if we did do something wrong. Where does that come from? It comes from, I have to put it in theoretical terms. Of course, it would be different if I really got to know the person and I could help them to understand better. But it comes from having a too powerful, or what is technically termed an archaic superego. The superego is the value system of the personality. It's the part of us that tells us what's right, what's wrong, what's good, what's bad. It's the part of us that helps us to value basic values of good and bad, safe and unsafe, right? Okay, right and wrong. So when we have too strong of a superego, we can sometimes feel guilty about not being able to visit our poor mother who needs us, but we really can't go because we could be carrying the death sentence with us to her. We might come away okay, but without realizing it, we might transmit this horrible virus to our mom, and God forbid that she could die from that. So, it's easy to say you shouldn't feel guilty because of that, but to work on that is the important issue. And of course, the same applies to the children, only with the children, the younger generation, since they're more considered like super spreaders and carriers of this thing without being personally so terribly affected by it. They might give it to us, and then they'd have to live with killing us. And would we want to do that to our child? No. So there's the rationale for trying to undo the guilt, but there's a lot more to doing that work than just having those good cognitions. Okay.
Thank you. Ellen Tuckman, I noticed you had unmuted before. Did you want to ask a question? I had muted you back, but if you still have that question. I'm not sure. If any, oh, you have a comment. It's
I see something from Myra
yeah.
Bound that
that's-
she's bringing out a very good positive point that I would like to emphasize also, and that is this horrible situation has brought out some of the best in humanity in terms of helping us to really get our priorities straight, how important our health is, and helping others and being of service. We've seen, and I'm sorry, I can't think of a good example right now, but I have seen excellent examples. Maybe somebody can supply this for us where, oh, I remember now. One 9-year-old kid was on TV because the newscaster was highlighting that this 9-year-old kid had made 1,500 meals for people who needed food because they knew about this virus thing and that people were having trouble getting food. So, you know, it has brought out the best in us also, which seems to be part of our human nature, that sometimes it takes a tragedy before we can see how good we can really be to each other.
Yes. Phyllis, you had a question or a comment?
Jerry does.
Dr. Salomon,
Yes.
how is the field of psychoanalysis functioning these days in the era of 15-minute office call and the bean counter saying you must see 20 or 30 patients a day, we're going to cut your salary, doctor?
I'm sorry, my hearing is not that good and I didn't hear everything you, start again.
How is the field of psychoanalysis functioning in today's era of 15-minute office calls and the bean counter saying you must see 30 patients a day?
Yeah, not well, but it really doesn't take that too much to heart, because psychoanalysis was never that strong or sufficiently developed, with one exception that I will happily talk about in a second, for the masses. Okay, it's more on the principle, if you can help one person for the rest of their life, you have done such a good thing, a mitzvah in our terms, that you can feel that you've been a good, wonderful doctor. The one exception, which breaks my heart in a way because of what happened to it, was the comprehensive community mental health movement of the 1960s and 70s that just lost its spirit and the funding. Well, I think first it lost funding and then it lost a spirit. No one really stood up for it and picked it up. We still see a few community mental health centers, but not many. But in New York, we had many, and they were great. And you didn't have to have money. You didn't have to have insurance. They were all on a sliding scale basis where all you had to do was give something. And it didn't matter how much or what it was, but you needed to give something, and then you could get good quality psychoanalytic care. And then we were busy like crazy there. We were so busy that, you know, we were happy to go home after a long day's work. What happened to the CCMHCs? I want to know if anyone knows that.
Say that. Who are you asking that to?
Hashem and his children.
What is your question? The initial.
What happened to the comprehensive community mental health centers? What happened to them?
Do you consider I mean, this is such a bad example, but to a degree, free testing for COVID, is that sort of like a community?
That's in the spirit. That's in the spirit, yeah. Except for the free part.
You're saying it doesn't have to be free. That's the idea.
It shouldn't be free. Being free is fraught with problems because ultimately, subconsciously, it leads to some kind of problem in the recipient that they haven't given anything for what they've gotten. And we're not built that way. We're not built to do that. Sometimes we can't, and sometimes we need to wait to pay back, but we should always try to pay something for what we get. Life is give and take, right? So we should always try to give when we take.
Before we sort of wrap up, because first of all, thank you very much for all of your time. Are there any other questions? I know that on the chat we're good, but if anyone has a question, Lori, I see you just unmuted your mic.
Yeah. So Felix, thank you for doing this.
Oh, you're very welcome.
The question I have is fear knowing what you're up against and anxiety not having the information that you need. So gaining the information you need will decrease your anxiety and maybe put you in fear.
Yes,
So
but then you'll know what to do.
are you okay, so you're not as debilitated.
Right, you're not at a loss anymore.
And you're able to, you're not stuck, you're not, you're able to act, and cognitively you have the ability more so than if you're anxious.
Right. Right.
So where does stress come in there?
Where does stress come in?
Yeah, I said, if, you know, where would that
we always have stress. Always. There's always some demand coming from the outside world. And some of you might be familiar with the most incredible researcher on stress, what I think was I'm not sure what he was. I'm going to say a Swiss psychiatrist by the name of Hans Selye. Okay.
That's it.
Who somebody said Selye, they nailed it. Okay. So he said there are 3 stages to stress if we're not dealing properly with it. The first stage is alarm, which is normal and natural. Oh, here's a demand. I'm alarmed. I'm aroused. You've got my attention, world. Okay. The second stage, though, if you don't really deal with it, is adjustment. So you get used to the stress. The third stage, though, is collapse. The organism dies or collapses. Insanity might be the result, and insanity is a living death, in my way of thinking about it. And that's because you thought everything was fine and you just went along with it and didn't do anything about it. It has a cumulative effect on you, and it will cause you to collapse. So he called that the GAS, the General Adaptation Syndrome, GAS.
Another question from...
I'm just to clarify, you said alarm, adjust, and collapse?
Alarm, adjust, and collapse.
So if you don't deal with...
Adjust might not be the right word. It might be more, I don't know. Yeah, let's say adjust.
So that sounds like
make accommodation.
That sounds like it's going in the right direction when you start with alarm and adjust, but then collapse sounds like a big difference. That's bad.
Because adjust is not adjust in the good sense where you're actually doing something to deal with the stress. What you're really doing is working around it more. You're accommodating it. There's a certain term called pathological accommodation in psychoanalysis, where you're just bending yourself out of shape to fit around what's killing you. But really what you should do is eliminate what's killing you.
And I don't follow that. Because
What's
again,
not to follow?
adjust to me means you're adjusting to it,
Yeah, well,
which is going in the right direction.
that's not what it means here, though. That's not what Selye meant. Think more of pathological accommodation, if that helps you.
Doesn't really mean anything to me.
Pathological accommodation? Working around something without stopping it from bothering you and without changing yourself, it, or moving away from it. There are three healthy ways we have that we can address it. One is to change ourselves. One is to change the environment. And the other is migration, moving away.
Oh,
Those are the three main ways.
okay. Is there such a thing as education? Educating yourself so that you know all about whatever it is.
Yes, of course. But then you need to use that education and not just like study Torah without doing acts of kindness is not what Hashem wants.
Right. I'm talking about if somebody says to you, you shouldn't eat fat, and you
Right.
educate yourself why you shouldn't eat fat.
Yes, and if you keep eating fat, even though you've educated yourself very well, what good is your education?
Doctor, in the chat, I guess this was sort of to use other words for adjusting. They were asking, do you mean acclimate, sort of, or
That's
not?
a good one. Yeah, acclimate.
It's there. You're not addressing it.
Yeah. How about assimilate?
But okay. I mean, there's probably a lot of synonyms for this one.
And they all start with A. Isn't that interesting?
I'm sure you thought about it. So I just, I think I don't want to take more of your time, but any last minute questions for Dr. Salomon before we wish him a good Shabbos?
Shabbat shalom, everybody. But I'm open to a few more minutes if you have.
Oh, sure. Okay, so yeah, if any, I have a question. You mentioned about guilt. This has nothing to do with necessarily addressing things for ourselves, but in the sense of society's talk about reparations.
Yes.
Where clearly I don't think guilt should be for something that happened for generations before you, and I'm curious what the psychoanalysis is.
That's a tough one. I'm not sure how I feel about that. I tend to agree that we should not, and I tend to agree that we should not have to pay for, quote, the sins of our fathers, unquote.
Right. Yeah.
However, there is a sense of humanity that I think we should all have, and a sense of fairness that what is it in Hebrew, Rabbi? Justice shall you seek.
Tzedek, Tirdov.
Yes. So the tzedek is maybe reparation. I don't know.
Well, I mean, I'll ask, and again, it doesn't have to become political. I meant more in the sense of, and I think you haven't.
And it doesn't have to be monetary either.
Correct. Well, and I really like the quote about sins of your father, because
Yes.
I think in Torah you're never expected to correct something that a family member has done. But like
Right.
you said, justice is a very big word. That doesn't, just because you don't have an obligation doesn't mean you shouldn't or can't, or, you know, that's another conversation.
Right.
And if we talk about that, of course, the conversation can be had about the Jewish people as well. So I'm not necessarily tying this to the demands on race currently. But my question is, in the sense of psychoanalysis, should there be a guilt? Let's say, God forbid, a person is a child of a serial killer, or we can name the crime. Should that child have guilt? Will they have guilt is another question.
We can feel guilty about not having guilt.
Yes, I feel like that's the best line. I always love that line. I feel guilty for not feeling guilty.
Right.
But
What's wrong with you? Why don't you feel guilty?
Exactly.
No, there's one thing I think that we can do, which we haven't discussed, is not carrying on the thing that caused the guilt in the first place.
Right.
I think this is a thing that seems to be out of balance in this. In other words, we should, they're looking for, a lot of people looking for some kind of a gift having to do with something horrible happening in the past. The gift should be that this horrible thing never happens again.
Right.
That's truly a gift, because it changes the attitude of the nation and of everybody else
Right.
that caused the problem in the first place.
I think this is an opportunity for us to maybe right some wrong. And also I like the expression, give a hand up rather than a handout.
That's precisely what I had in mind.
I don't get the big bucks for nothing.
Anyone else have anything they wanted to add? I see a couple unmuted mics. Sherry, did you want to add something?
What about the medication issue? Did
Ugh.
you address that? You hear so much.
I'm very biased against drugs and medication. There are certain conditions for which medication is absolutely necessary and a godsend, but I feel that it's so overdone, overprescribed in our society. You know, living better through chemistry is not really living better. It's really covering over with a chemical blanket what really needs to be confronted emotionally, psychologically, and relationally. That's my
So
two cents.
use your word for stress earlier. Is that considered adjusting? Or sort of you're dealing with it to a degree so it can't be considered
If you're dealing with it, you know,
chemically?
you're not taking a pill to make it vanish.
Mhm.
It's just because you don't get on the scale doesn't mean that you're not gaining weight.
Right.
Right.
Yeah.
I don't want to get too political.
No, this was thank you so much. This was,
Yeah, I like your
first of all, I guess I should say thank you for not getting political too, but that's not what I meant. That might bring out stress.
Yeah.
Yes, yes.
But thank you so much for this presentation.
Thank you, Rabbi, and thank you, congregation and Jewish people and all people who might not even be Jewish here. That's okay, we're all people, and thank you for this opportunity for contributing something. I feel I've learned something here too, so thank you.
Thank you. Thank you. And of course, you're welcome to stay on. Whoever would like to stay on now and schmooze, always a great time socializing. But I'm going to officially wrap up the formal part, if I can use that, the presentation. So thank you so much
Thank you.
for all of your wisdom and time.
Thank you.